Hi, this is Dr. Jeremiah Peck with Ally Academy Northwest, and welcome back to our video series on passing the National Counselor Exam, or NCE. In this video series, we are examining the 8 major core content areas that make up the questions of the NCE. And in this video, we're going to be looking at group work or group counseling. Now, it's as such that I really recommend to everyone that I coach and work with in taking the NCE that I recommend that this, as well as another section that we'll talk about in another video, is one that you spend a great deal of time familiarizing yourself with by additional studies and information, including watching this video. Reason why I highlight group work is not because it serves as a topic that has the majority of questions by any means, but rather I often encounter folks that in their specific academic program, if they were in a clinical mental health program or other academic training that did not focus specifically on group counseling, they may not even have some familiarity with some of the concepts we'll talk about today, or they have not practiced these concepts in their professional practice if they did not intend on pursuing the work of being a group counselor. So I find that this information, specifically in relation to passing the exam, is one of those pivotal bits of information that can really help you get over the passing score needed on your total exam. One of the concepts that very well may be referenced in your specific version of the exam is Irvin Yalom's 11 reasons why group counseling works so well. I'm just going to list these out. The first thing he talks about is altruism, the idea that helping others, and that helps the person. The universality of someone experiencing that they're not alone in what they're experiencing. That can give them hope as a third thing. It can also be cathartic to both hear other people's stories as well as have an opportunity to express your story. There's a support that comes from a group dynamic. They call it a group cohesiveness. Also, not just cohesiveness, but Yalom also outlines that people may imitate each other and pick up on the modeling of someone else's success. Sometimes the group dynamics can be very healing for someone in ways that family reenactment may take place and insights may be achieved during a group counseling dynamic. Sometimes people just teach each other. There's this whole idea of what Yalom just calls imparting information as being really present. The significance of the relational or interpersonal learning. Group work can also just be helpful for individuals who are experiencing distress, gain a great deal of experience in socialization and being able to relate to other people in view of the goals that they have or what they're experiencing. And then lastly, group work often can entail some greater existential factors. Some group work is based around spiritual considerations or considerations of a higher power, and some of those existential reasons which may transcend the person can often be beneficial in the idea of group work as well. Some best practices as it relates to group work may be reflected in your test questions, and that is that effective groups generally vary between 6 to about 10 members. Those are some of the best practices surrounding the size of the group. And then by way of how long a group lasts, generally 6 or more months can be a good sort of best practice surrounding the longevity or the length of a group. A group can either be open or closed, which means a group with open enrollment where people can come and join the group at any time, where a closed group begins with a cohort that commits for a certain period of time. And then there can be leaders of a group or facilitators and even co-facilitators of a group as well. There's something called the FSNP, in group work, and that's the forming, storming, norming, and performing. And it's these 4 stages of what a group goes through as they're collaborating with one another. Forming is, of course, the group coming together or forming together. Storming is the process of ironing out the dynamics. The norming is when those dynamics become standard when you get into the group routine, and really the performing is moving towards achieving those growth aspects and those desired outcome. One element that will likely be emphasized in some questions as it relates to group work are the responsibilities of the group facilitator or leader. It's really up to the leader to model appropriate behaviors in the group counseling context. The group leader is responsible for monitoring and ensuring as best as they are able to the safety of group members, that you're not forcing exercises or interventions or exposure beyond people's level of comfort. Oftentimes you see effective group work is one that is welcoming, is one that is safe, and it's not generally very high pressure environments or circumstances. Group members need to be aware of their own autonomy and agency, their ability to choose the depth by which they are encouraged to, but ultimately still have the choice to participate in. Some different styles are noted in literature by way of the leader's experience. More leaders can make decisions for members that can be more of an authoritative or authoritarian style. Sometimes leaders choose to be more laissez-faire or hands-off in their leadership approach. Leaders can sometimes go back to the group and offer more of a democratic leadership style so as to give the group members a collective responsibility for shaping the group dynamic. Sometimes leaders will rely on their own personality, their own charisma to gain influence into the group. And sometimes leaders who are more confrontive can rely on self-disclosure to influence group members. There are various types of groups that someone could run, and you may encounter these groups, questions about these groups in your questions as well. I would encourage you to familiarize yourself with this. Groups can be psychoeducational, which means it's not necessarily based on certain therapeutic outcomes, but instead it's about a group of people both being exposed to information and processing information. Sometimes psychoeducational groups can be focused on a specific diagnosis, can be in support of people who are caring for loved ones and need to know more about what their loved ones are experiencing. Sometimes psychoeducational groups can be topical, and we see various examples of those. Psychoeducational groups typically place a greater deal of emphasis on the facilitator also being the teacher or conveyor of information. It's not to say that the facilitator is simply lecturing, but the goals of the group have to do with in participants gaining more awareness, insight, and learning outcomes are a great part of psychoeducational groups. And then there are simply counseling groups where people do come with presenting problems, and counseling is taking place in really a group context. They're navigating these personal struggles as they move towards their own goals. It's important in group counseling by way of ethics to navigate well the waters of privacy and confidentiality. This goes back to those stages where you're setting the expectation. It truly can't be guaranteed that the content of the group is kept private and confidential. Can't be fully guaranteed. However, as a ground rule, that you can set as a facilitator is to honor and respect privacy as a boundary in the group counseling context. Some literature cites, and this is significant for you to be aware of, that group counseling sometimes is distinct from group therapy. Sometimes group therapy has a connotation to be more psychodynamic in nature, looking more at the past impacting the present, looking at root causes, and not just the change of behavior that can sometimes come with doing group work or group counseling. Sometimes group work can be structured, can take more of a training dynamic to teach someone skills, can be skill building. Sometimes group work can take sort of a self-help route when someone is trying to work on a specific area of enrichment. And you can also see group work, by the way, involve a great deal of support groups. These can be less structured by way of a set amount of time. Oftentimes, support groups are rarely closed, but more often they're open groups where people who are struggling with a similar experience can simply come together and experience that cathartic social support of expressing and experiencing some validation, affirmation, and also still be able to gain some helpful experience from the facilitator as well. More sort of ethics and even cultural strategies to incorporate into group work that is helpful for you to be mindful of is to still be mindful of the cultural considerations as it relates to different group members' experiences. Part of the process of group work is recognizing that many of the members will have some form of commonality, but also the group members may have very likely areas of uniqueness. And as a group facilitator, you are exploring both of those things. They may have commonalities in some of the overall themes of their presenting problems, or common overall themes in their goals. However, really as a group facilitator, you're avoiding the pit traps of comparison. You're avoiding the pit traps of someone saying that they know exactly what someone's going through, or they know exactly what the other person needs to do, because then that would be looking for similarities to the disadvantage or to the de-emphasizing of the unique elements of someone's experience. Keeping in mind, if you're doing grief work in a group context, though two people may have lost a similar person, their experience of grief is still going to be unique to them as individuals. So comparing loss or comparing severity of loss or comparing saying they know exactly what the other person's going through, those statements are often not as helpful in a group counseling context. Sometimes you're facilitating activities that are approved by your program or your group if you have a more democratic style. And all of those activities, it's important to note ethically that they're still in service to the greater objective, stated objective, documented objective of that specific group. I encourage you, in addition to familiarizing yourself with the theory and practice of group work, like we've discussed today, is to take a deep dive into some group theorists and do some research in studying specific people who brought about some of these core tenets of group work, as some of those names or dates will likely show up on your exam questions as well. Thank you so much for watching this video on group counseling in the NCE as a topic area, and I will see you in the next video.